Good afternoon. My name is Walt Priest, and I'm the CEO of Family Health, which is a Tier 3 CBO, federally qualified health center, which we're privileged to serve about 20,000 individuals, 8,000 of those individuals who are Medicaid lives. I'm also Vice Chair for Care Compass Network, the PPS, serving 9 counties in upstate New York. And I have a few brief comments, and I'm glad to brief because I'm getting very nervous about Simone over there with the cards. So let me tell you a little bit about CCN first, Care Compass Network. It's a 9-county PPS serving over 200 partners in a region that's spanning about 1/8 of New York State. It's a tremendous geographic coverage. It's a complicated landscape, including 5 health systems, 9 hospitals, 3 regional health information organizations, and over 100 community agencies. Right now, I think our funds flow is working. We're happy to report the Care Compass Network has distributed 60% of its earned funds, and of the funds distributed, 80% has gone to non-hospital partners. And speaking as a CBO, and one of the reasons I wanted to get up here today, is that I would like to take a moment, and we've heard from others that had similar experiences, to say what an enriching experience it has been as a CBO. Family Health Network's participation in Care Compass Network has opened the door to numerous opportunities to work with other partners to serve our population differently. As you can imagine, if you span 9 counties, the opportunity to work with other people is fairly limited. I will share with you, as an attempt to brag also, is we just had our triennial audit at Family Health Network, and we were fortunate enough to achieve a perfect score. One of the major components of that is the ability to be integrated with other organizations, to have the ability to coordinate services, to be able to have continuity between the organizations. The PPS has accomplished much of that, and I really do owe a debt of gratitude to that. That being said, we are a highly engaged organization, I believe Family Health Network is, with Care Compass Network, and many of our members do contribute many hours, and this is very hard work, as you all know. It takes time and consistent commitment. We have to balance our bandwidth and cannot spend the time all at once to do the things that we'd like to do. But I do believe our PBS is progressing, and again, I'm proud to be a member. As a CBO board member, and I feel that I stand, and so do other CBO members, in equal standing with the hospital members of the board. Our organization has been involved actually since it started, when I had the pleasure of working with Robin Kinslow Evans here in an auditorium filled with people wondering what the heck DSRIC was. It has come a long way. CCN has balanced the DSRIC requirements and made opportunities unilaterally on the basis of the needs of the Medicaid members in our region. We're extremely proud of what we've accomplished and where we are today. The strategic planning was a wonderful effort that I wish we had videotaped, because the CBOs were highly involved in that process. Everything we've done has been through full collaboration from our partners. While that level of collaboration has taken time to mature, as all things do, it is currently yielding important results. For example, supporting a regional adoption of value-based payment plans through a blend of Level 1 and Level 2 arrangements covering over 75,000 lives in our region. DSRIP, as you know, in healthcare evolution, is about transformation, and by default, it's about learning. Here's what I've learned. I've learned there is no effective value-based payment transition without value-based care. And right now, Care Compass Network, as in the other DSRIP organizations, are learning the basics of how to make that work. I would implore that that continue, and that funding and the efforts and the organizational efforts of all the PPSs continue well beyond 2020. Thank you.
Good afternoon. My name is Kathy Connerton. I'm the CEO of Our Lady of Lourdes in Binghamton, New York. I'm also the chairperson of the PPS that Walt just spoke of, Care Compass Network. I'm here today to really add on to what Walt said and to add a few comments that I think are important that haven't been said yet today. As we established our PPS, we brought together 5 competing health systems in our community who never really spent a lot of time together and competed mightily. This disrupt project brought the forum to bring those 5 health systems together to force a conversation that needed to be had for many, many years. In our region that Walt spoke of, the 9-county region, despite all the resources that the hospitals have expended over decades, our health status has gotten worse, not better. And what we have come to recognize because of disrupt and the forum that has represented is that we can't change health status alone. So today I stand to advocate for the extension of the waiver past April 2020, but also equally important is to continue funding and an opportunity for the community-based organizations in all of the state of New York to continue to be funded and have a voice in this care model. We cannot change health status in the state of New York without community-based organizations like the ones you've heard from today and 150 others of them in our PPS that are not here today, but have large voices and should have large voices. Nothing speaks more clearly to me than a story. So as you looked at your spreadsheets today and the funds flow that you start to see, you have to look behind the spreadsheets and you have to look behind the regulations that the federal government and the state have given us to operate in. 95.5, the CRFP grant funding have all created the idea that the funding is going only to the hospitals, and that just isn't true. In our PPS, I'm excited to say that 80% of what has been earned has gone to community-based organizations and will continue to. Our board of directors has more members from community-based organizations than it does hospitals, and that was deliberate. But the story that I wanted to tell you about is a pilot project that we have in my hospital that has taught us a lesson as Our Lady of Lourdes, but is also creating a different relationship for primary care providers to have in our communities. We have a pilot project going on now with a population of patients that is not yet diabetic, but certainly has all the characteristics of becoming diabetic. And we're trying to stop that, and we're trying to find ways to do that. And the endocrinologist in our community who's leading that effort came to my office one day and said, "I don't know how much longer I can do this. I'm burned out. My staff spend countless hours trying to take care of social determinants to which we don't know where to send patients, we don't know who to connect them to, and we're not able to do our job, and we're not able to create a better environment for our patients." And then came disrupt. And now I'm proud to say that all the patients that are in his pilot study at trying to prevent patients from having diabetes, they're all improving their A1C. And they're not going down the road of becoming another diagnosis of a diabetic. But because of the efforts of disrupt, and now the 57 community-based organizations that he and his nurse navigator work with this patient population to ensure that people are getting transportation to the services that they need, to grocery stores where they can shop for food that's healthy for them, for cooking classes and other things that they need to start to change their health status is a reality. So in our PPS, I'm proud again to say that I partner with Walt and many others, and the hope is that we can continue this and not stop it here. We're only starting to learn what this can change. And change takes time, and culture takes time to change. And for our health systems in our community who have competed mightily for many, many years, we're learning together that we can't do it alone. We need every single one of these community-based organizations to have funding, to have the capability to have enough workforce to help us take care of the population that we have. If we can continue to keep this going forward and we can continue to raise up the capacity of the community-based organizations in our state, we can change healthcare. Thank you.
Thank you.